Okay, recording is on. All righty, let me get started here. Okay, this will go as if you were a client, right straight. Okay, the name of the company is Philadelphia American Life Insurance Company, and they're actually headquartered in Houston. Don't ask me why a company named Philadelphia American is headquartered in Houston, but it is. I believe they started right around 1924. Okay, so this is why your ACA plan is so much more expensive, almost twice as much as this plan. And this is why. It's because they have to have the 10 essential health benefits embedded in them. And these are the 10 essential health benefits: hospitalization, prescription drugs, emergency services, laboratory services, ambulatory patient services, maternity and newborn care. Now, this plan does not have maternity and newborn care. So just to let you know, Maria, if you're in that situation where you're looking to have more children, this will not be the plan for you. This plan also does not have pediatric, dental, and vision care. So those two things are taken out, and that brings the cost down. Rehab and facilitated services and devices, preventative wellness and chronic disease management, mental health, substance abuse, and behavioral health, all of those things are incorporated in this plan. Okay, in addition, all ACA plans must also have no pre-existing conditions limitations. A good example of that is this. If you have a pre-existing condition, I don't care what it is, that you are still covered under this plan. A good example of that is when I talked to someone in a hospital, I actually signed somebody up in the hospital. It was December 14th. Okay, and the effective date of that policy would be January 1st. And when signing them up with an effective date of January 1st, the insurance company had to take over the cost of that plan immediately, January 1st, without getting any premiums. That adds to the cost. That's one thing that adds to the cost. This plan here has unlimited coverage. That's something else. I just muted you again because there's a lot of background noise. This plan also has unlimited coverage. Unlimited coverage meaning that there is no cap on how much money you can actually spend on the plan, which is a good thing. And this plan also has no copays for routine physicals. So with the ACA plan, when you actually go in to see a doctor, you don't pay a penny. There's no such thing as a copay. It's free. With this plan, there's not a copay, but there's a reimbursement, and I'll go over that with you in just a second. Now, this is called the Health Saver Plus 3. This is a limited benefit fixed indemnity plan and not a major medical insurance plan. Fixed indemnity benefits are provided for hospital confinement, specified medical, surgical, and outpatient events. These benefits are paid in specific amounts and do not provide expense reimbursement for charges based on your healthcare provider's bill. Okay, now, here's the plan comparison. I'm going to compare here a major medical plan, and I'm going to compare that to a hospital indemnity plan. Now, the first thing you do with a major medical plan, just to let you know, is when you walk into the hospital, they want you to pay your deductible, or they want to know how you're going to pay your deductible. A good example of this is my wife. She had to go in about 6 months ago to have emergency surgery for a kidney stone. And when we walked in, we saw the lady at the desk, and as soon as we saw the lady at the desk, first thing she did was pointed us over to finance. She wanted to know, how are you going to pay your deductible? All right. Now, with a hospital indemnity plan, is different. You actually pay your deductible last. Now, here's the page we were discussing when I was in the car earlier. How deductibles are applied under a hospital indemnity plan. The deductible is applied against the eligible benefit, not the eligible expense. It's simple. Add up the reimbursement for all eligible benefits and subtract the selected deductible. Eligible benefit based on 3 units. Now, I know you don't know the definition of a unit yet, but I will define that for you in just a second. Now, a 3-day hospital stay for an injury, the plan will pay $6,000 per day. 6 times 3 is $18,000. So the plan for those 3 days for the hospital only, it'll pay $18,000. Now the surgeon gets a separate bill. So remember, when you go to the hospital, you have 2 bills. You get a surgeon's bill and you get a hospital bill. For the surgery, the surgeon will get $4,954.65. The anesthesiologist always gets 25% of what the surgeon gets. So in this example, the total eligible benefit is $24,193.31. Now I'm going to subtract the deductible. So this is the total benefit paid. This is the amount the insurance company pays. This is not the amount that the hospital charges. So the total amount, the total paid benefit after we've subtracted deductible is $21,693.31. Now, had the total bill come to $18,000, then if the hospital had charged $18,000 and the plan paid $21,693, that's a difference of $3,693. So that's an extra $3,693 simply because the hospital is charging less than what the plan pays. In that example, as a client, Maria, you would actually get the $3,693.31. On the other hand, if the hospital charged $24,000, that's a difference of $2,307 roughly. Okay, in that example, you would actually owe the hospital $2,307. The whole purpose behind this presentation is to show you how to keep your cost below what the plan will pay. Okay, are there any questions?
I'm good. I'm good. I'm good.
Okay. I'm going to mute you again. Okay, Health Saver Plus 3 is a hospital indemnity plan. Since all the benefits are defined in the plan, it allows the consumer to know exactly what the policy pays before accessing any healthcare services. So, again, as I said earlier, with the ACA plan, there is unlimited coverage. With this plan, there's a $5 million lifetime maximum per policy, not per person, but per policy. You can choose from 3 benefit options. You can pick your base plan deductible, you can pick your calendar year benefit maximum level, and you can pick the number of benefit units to fit your needs. And you can use any doctor or hospital you choose, or you can select the PPO option to take advantage of greater savings. Now, what I'm going to show you a little bit later in the presentation, I'm going to show you how to take advantage of the PPO options to always keep your costs below what the hospital would charge. I mean, below what the actual plan will pay. That's very important. But remember this, the plan will always pay. The plan pays what it does. It doesn't matter if you're in the PPO network or out of the PPO network, the plan will pay. All right, so here are your 5 calendar year deductibles: $100, $500, $1,000, $2,500, and $5,000. You're priced right here at $2,500. I usually price everyone at the $2,500 deductible. I personally think it's a waste of money to get these down here, simply because on your first day in the hospital, outpatient stay in the hospital, and you have general anesthesia, the plan will waive that deductible. And I'll go through that in just a little bit, in just a second. Now, like I said earlier, you can choose an annual maximum benefit. Now, you are priced right here at $250,000. Now, keep in mind, the plan's maximum benefit per family is $5 million. However, the maximum per person is $250,000 per year. If you're not comfortable with that, I can up it to $1 million per year. All right. Also keep in mind that at the end of the year, as of today, you can still go back to an ACA plan. So if something does happen to you, you only have to last till the end of the year when an ACA plan can be gotten and taken up. And guess what? You can still keep this plan, and this plan will continue to pay even if you have an ACA plan. So what I want you to do is to think about the annual maximum benefit as a bucket of money you just purchased. So you just purchased $250,000. Each time that you have an eligible medical expense, money comes out of the bucket to help pay for those expenses based on the benefit plan you selected. And every year, Philadelphia America refills the bucket. So every year, starting January 1st, Philadelphia America is going to give you a check. Well, you're going to have $250,000 or $1 million, whichever one you want, in that bucket of money for you to use. And that's per person in your family. Now, earlier I told you I was going to give you the definition of a unit, and I'm going to do that now. But first, keep in mind that when you do go to the hospital, you're actually paying two different bills. You're paying a hospital bill and you're paying for the surgeon's bill. This is the facilities fees right here. And remember, you're priced under 2 units. Unit, that's all that is a category of benefits. So this is a category of benefits right here. So for sickness, the plan will pay $3,000 per day. And for an injury, the plan will pay $6,000 per day. If you're not comfortable with that, you can get 3 units, and the plan will pay a little bit more for sickness. Hospital ICU, up to 20 days, the plan will pay $4,500 a day for sickness and $6,000 per day for an injury. For mental illness, alcohol, and or substance abuse, the plan, this is stackable, so the plan will pay $400 a day plus $3,000 per day, or $3,400 per day. For rehabilitation facilities, skilled nursing facilities, the plan will pay $4,500 per day. For outpatient radiation and chemotherapy, the plan will pay $1,500 per day. And this right here is very important. Outpatient hospital or ambulatory surgical center, the plan will pay the daily indemnity benefits selected for outpatient hospital or ambulatory surgical center services when surgery is performed as a result of a covered injury or sickness. The calendar year policy deductible will be waived for the first claim incurred in a calendar year for each covered person when surgery is performed under general anesthesia. That pays $3,000 a day. So what does that mean? That means if you do not spend the night in the hospital and you're put under general anesthesia, meaning you're put to sleep, that $2,500 deductible is waived for the first surgery incurred in a calendar year. Your second surgery in that year, you'd have to pay, excuse me, that $2,500 deductible. Now, remember I told you when you go to the hospital, you actually pay two different folks. You pay the facility and you pay for the surgeon. In this case, we have 2 units, and this is for the surgeon's fee. So the plan will pay the daily surgical indemnity benefit if any covered person undergoes a surgical procedure when performed in a hospital or ambulatory surgical center due to an eligible injury or sickness. When the surgical procedure is performed in an outpatient hospital or ambulatory surgical center, the deductible will be waived for the first claim incurred in a calendar year for each covered person when surgery is performed under general anesthesia. And this part is very important. The reimbursement schedule for 1 unit is similar to what is payable under the Medicare physician's fee schedule for surgeries. You may acquire up to 3 units based on the plan. So the hospital is getting its money. Now it's time for the surgeon to get its money. Now, what is the Medicare physician's fee schedule? As an example, with the Medicare physician's fee schedule, that does not allow a physician to charge outrageous prices for a surgery. So if the Medicare physician's fee schedule says the cost for, say, carpal tunnel, an operation on your arm for like typing or something like that, that cost of that operation can be no more than $100, and the doctor wants to charge $1,000, the doctor, and he accepts Medicare, the doctor can only charge $120. The doctor can always charge 20% more than the Medicare physician's fee schedule. So in this example, you have 2 units. And in this case, the Medicare physician's fee schedule was $100. So 2 times 100 is $200. So in this example, the doctor would get $120 and you would get the other $80 because the doctor can't charge more than 20% of the Medicare physician's fee schedule. Inpatient pathologists and radiologists, again, you've got 2 units. Physician's care indemnity benefit non-surgical, the plan will pay $100. Now, what is this? Now, a few years ago, I had prostate cancer. And when I had prostate cancer, my operation was on a Thursday. And on Saturday, the doctor came in to see how I was doing, and he signed a little chart. When he signed that chart, he only was with me for 5 minutes. He got $100. He had 30 other patients on that floor. 30 times 100 is $3,000. So that doctor, probably about an hour, hour or two's time, he made $3,000 just by going by and signing that little document. The assistant surgeon always gets 20% of what the surgeon makes, and the anesthesiologist always gets 25% of what the surgeon makes. Now, calendar year outpatient deductible. Now, this is separate. This is like when you go to the doctor, there is a $50 deductible. However, this deductible is waived for the first 3 visits to a doctor. You don't have to pay that $50 deductible. The plan will pay for each day a covered person sees a physician in a physician's office or outpatient clinic. Calendar year deductible is waived for the first 3 visits. So, as an example, in this particular area, before we use the PPO discount, and I'll get to that in just a second, before we use the PPO discount, the cost of a doctor's office appointment is about $120. In this area is discounted to about 47%. But let's round it up to 50% to keep the numbers even. So the cost of the actual doctor's office visit is $120. You go through the PPO network, it's discounted by 50% to $60. In this example, when you go to see the doctor, you actually pay nothing. Nothing comes out of your pocket when you pay the doctor. On the other hand, if it was discounted to $80, you would have about a $20 copay. On the other side of the coin, if it's discounted to $50, then you would get $10 and the doctor would get the other $50. Other outpatient daily indemnity benefits per day. For MRI, CAT scan, nuclear testing, the plan will pay $350. Now, again, in this area, the cost for an MRI or CAT scan, once it's gone through the network, is about $600. In this example down here, the $50 deductible is applied immediately. So in this example, we want to apply the $50 deductible. That brings it down to $300. 600 minus 300 is $300. So in this example, you're going to have $300 out-of-pocket expense. Other diagnostic testing and x-rays, the plan will pay $80. Now, keep in mind, these 2 benefits are a lot greater than what I'm showing you right now. I'll show you that in a second, but if there's an accident, this benefit is enhanced tremendously. Laboratory testing, the plan pays $20. Injections, the plan pays $10. The daily generic prescription drug indemnity benefit, the plan will pay $10. And this is the only part of the presentation where there's a reimbursement. So the policy reimburses on this part. This is the only part. So as an example, if you go to Walmart, you can get a $4 prescription generic drug. In that example, you would pay the entire $4 and you would be reimbursed $10. Therefore, you would actually make $6 off of that. If I were you, if you get monthly drugs, I would add up all of your receipts over a period of a year, and I would send them all in at once as opposed to sending them in once a month. The daily brand prescription indemnity benefit for brand drugs is $20. Emergency room benefit, limit 1 benefit per covered person per calendar year. It's $200. Again, this is going to be discounted in the network. Urgent care center, 1 benefit per covered person per year, $100. Now, preventative care benefits. Listen to this part carefully, because I had a client who actually went in and she used this benefit prior to the 60 days. Preventative care benefits. Coverage starts 60 days after the effective date and is limited to 1 benefit per person per calendar year. This benefit is not subject to the calendar year deductible or pre-existing conditions exclusion. This part of the plan will pay $125. And this includes mammograms, colonoscopies, things like that. On the daily emergency ambulance indemnity benefit for ground, the plan will pay $500, and for air, the plan will pay $1,500. Now, if you're in an accident, this is enhanced tremendously, and I'll show you how that's enhanced in just a second. Now, what is the definition of a pre-existing condition? A pre-existing condition is a condition for which treatment was rendered or recommended by a physician, or for which drugs or medicine was prescribed within 12 months prior to a covered person's effective date and will not be covered for the following 12-month period. A more positive way of putting this is pre-existing conditions are covered after 12 months of continuous coverage on this policy. Now, it is important to note that pre-existing conditions applies to all benefits with the exception of preventative care benefit. Repricing is still available through the PPO network. Now, while you can use any doctor or hospital you choose without penalty, you have the option of accessing the PHCS network to take advantage of great savings at no additional cost. So, this is where I wanted to get in the presentation. This is very important because I want to show you how to keep your costs below what the plan will actually pay. And here's how the plan works. The policyholder will present POLIC, which stands for Philadelphia American Life Insurance Company ID card at the time of service. Doctor or hospital will verify coverage based on information on the card. Charges will be forwarded to the National Claims Clearinghouse. The National Clearinghouse will electronic forward information to ECOM, who will reprice the claim. ECOM will reprice the claim and send it electronically into POLIC's claim system. The PPO discount will be shown on the EOB that is sent along with the claim payment to the provider of service. Benefits in most cases are assigned to participating providers. If the HSP policy pays more than the billed charges for less than the PPO discount, PPO allowable charge, we will send the provider the PPO allowable amount and reimburse the policyholder the difference. Now, here's some actual repriced claims. This is metacarpal fracture. This is the CPT codes. Anytime you have an operation, it's associated with a CPT code. The CPT code tells the hospital how much they can charge. So the hospital is charging $1,700 for that procedure, etc. So the total amount that the hospital is charging is $10,111. However, they're in the multi-plan PHCS network. The allowable amount under the network is $4,361.18. The total savings in this example is $5,749.82. That's a discount percentage of 56.87% discount. Now, Health Saver Plus 3 prostate cancer 3-day stay in a hospital with a $1,000 deductible. Now, here are your CPT codes right here. This is the expense. This is the amount that the hospital is charging. So the hospital is charging $24,848.89 for that 3-day hospital stay. The eligible benefit, the amount of money that the plan will pay is $22,303.04. Now we subtract the deductible. Like I told you earlier, always subtract deductibles at the end. So in this example, your out-of-pocket at the hospital is going to be $3,545.85. Keep in mind, if you had a major medical and you had a $6,000 deductible, you would have had to pay that money up front. But I've got good news for you. You're in the PHCS network. So the cost, instead of paying $24,000 for that operation, you're going to pay $14,909.33. The eligible benefit, again, the plan pays what it does, is $22,303.04. Now we're going to subtract out the deductible again. This is what you actually get back. You actually walk out of the hospital with $6,393.71. Now, keep in mind this is for 3 units. You're priced over here at 2 units. So let's use a 2-unit example. Again, the hospital charges the same amount. It's been discounted in the PHCS network. However, with 2 units, you're going to get less money than you would with 3 units. So in this example, your eligible benefit is $14,868.70. We subtract out the $1,000 deductible. And then we're left, when you walk out of the hospital in this example, you're going to be responsible with $1,040.63. Okay, this is just a multi-plan network, and what I normally do is I go through and I show you exactly how to look your doctor up in this network prior to you getting off the telephone. This is examples here in Texas of what some of the discounts are. So this is in Dallas. Since you're in Dallas, I'm going to show you how it works in Dallas. In Dallas, the number of acute facilities in Dallas is 74. And the number of ancillary facilities in Dallas is 1,341. The number of primary care physicians in Dallas is 3,599. The number of specialists or practitioners in Dallas is 9,582. So the total number of practitioners in Dallas is 12,100. The effective acute inpatient rate is 36%. The effective discount acute outpatient rate is about 33%. The effective discount ancillary facility is about 49%. And as I told you earlier, the effective discount for practitioner is about 47%. Okay, now, what I didn't tell you in your favor is this is actually 3 policies in one. This is also an accident plan. So keep in mind, the other policy is still paying. And where the other policy may be weak, this policy would actually take over. And I mentioned that earlier, and I'll show you what I meant. So this is an enhanced accident expense plan. The accidental injury benefit, the plan will pay up to $4,000 per incident. Now keep in mind, this is included in the price that I've already given you. So I already gave you a price, I think it was $600 total. This is included in that $600. This is part of it. So, but this is not like the other plan. The other plan, if you had money left over, in other words, if the bill came to $3,500, the hospital would get $3,500 and you would get $500. That's how the other plan worked. No, with this plan, the hospital gets just $3,500. You don't get the other $500. But this is per incident. So when I gave you that example earlier for X-rays and MRIs, this will cover up to $4,000, and the other plan will continue to pay. Accidental death benefit, you get an accidental death benefit with this plan up to $100,000. Ground or air ambulance, the plan will pay $10,000 for that. So if you remember earlier, the ground ambulance was $500 on the other policy. So in this case, for ground ambulance will be $10,500, and air ambulance will be $11,500 because on the other policy it was $1,500. In addition to that, you have a hospital income benefit that pays $300 per day income up to 30 days. And then you have dismemberment benefits. You have loss of finger or toe, single loss, $1,000, multiple loss, $2,000, loss of hand, arm, foot, leg, single loss, $10,000, multiple loss benefit, $20,000, loss of sight, single loss, $10,000, multiple loss, $20,000. Now, as I told you earlier, this is actually 3 policies. This is the 3rd policy. This is a crisis recovery critical illness policy. So if you happen to come down with something like cancer, this plan will pay you cash, no questions asked. I have already priced this into the current price that you have of $600, and you and your spouse will get up to $50,000 of cash, no questions asked. Now, this money can be used for mortgage, auto loans, and credit cards, anything. Now, a good example of this is when I had prostate cancer, I flew to Baltimore. And when I flew to Baltimore, I had to pay for the flight. I had to pay for the meals. I had to pay for my wife's flight. I had to pay to stay in a hotel, etc. Rent a car, all of that stuff. This, if I had this policy, and I wish I did, if I had this policy would have paid for all of those things. So this is an additional amount that's giving you cash, no questions asked, if you're diagnosed with one of those illnesses. I think it's about 11 critical illnesses that the policy actually covers. I'll go over that in just a second. So like I said earlier, you and your wife get $50,000. Your children are only limited to $10,000 on this. So you and your wife get 50 and your child gets 10. Now, in addition to that, it has 2 categories. It has cancer category, and it has a heart attack stroke category. If by chance you end up with cancer, the plan will pay out $50,000 for a lifetime. And then let's say a year later you have a heart attack. Statistically, that won't happen. But it will pay out another $50,000. So the total value of this product is actually $100,000. In addition to that, we also have Teladoc. Teladoc, as an example, let me explain to you how Teladoc works. Teladoc, if you have an emergency and you do not want to go to the doctor's office, you can use Teladoc. And you can call the doctor up. You can give him all of your information. You would actually do this when you first sign up with the product. Give him all of your information. And let's say you have a flu or cold or something else is happening to you. The doctor over the phone or via Skype will be able to write you a prescription and send it directly to you. The CVS will be filled. Someone else in your family can go pick it up and you don't have to wait in the doctor's office. Now, let me show you a couple of things about the critical illness policy that you asked me about. Let me show you how that critical illness would actually work. Just bear with me for a second because this takes a second to load. Okay, I'm just going to put a hypothetical person in here, and I'm going to just and non-tobacco, and we're going to say he's 5 feet 9 inches, 180 pounds. Okay, and I'm going to click the Health Saver Plus. I'm going to always click the critical illness because this is important, the Health Saver Plus. And I'm going to click on Enhance Accident. That also supports the Health Saver Plus. And I'm going to name this up here. I'm going to name this John Doe. And I'm going to make sure I have an effective date. I think my client, I think you wanted an effective date of the 1st. So I'm going to put the effective date up here. I'm going to go to the next screen. And we talked about units. I'm going to give you $250,000. I'm going to give you 2 units, and I'm going to give you a $2,500 deductible. This is what I give everyone. Okay, I'm going to pick plan option 1. Now, let's go over here and see what plan option 2 would be. I'm going to pick $1 million per year. I'm going to give you 3 units, and I'm going to pick a $5,000 deductible. Look, that's only an $83 difference. So, but I think you told me you wanted option 1. This is what option 2 would look like down here. Let's go with option 1, however. We're going to go with option 1, and I'm going to go to the next screen. Now, the next screen is our critical illness. Now, I'm going to put you at $50,000, like I said. I'm going to put your, ooh, forgot to put your wife in here. I'm sorry. Let me put your wife in here. I think she has about the same date. I'm going to put your wife in, and she's 5 feet 3 inches, 120, and I forgot to put your child in too. So that brings it up. Excuse me, that brings it up just a little bit. So let me go to the next screen. So as you can see down here, everybody is in the policy as of now. Go to the next screen. I'm going to click your wife for $50,000, and I'm going to click your child. Your child is in for $10,000. Now, remember I told you earlier the critical illness covers cancer. So if you have internal cancer, and this will tell you what each one is, and it'll explain it. But if you have internal cancer, the plan will pay 100% of $50,000. If you have non-invasive carcinoma in situ cancer, which is like what I had, which is prostate cancer, it'll pay 25% of $50,000, which is $12,500. Now, category 2 benefits, heart attack, it pays 100%, stroke, it pays 100%, coronary artery bypass surgery, it pays 25%, angioplasty, it pays 10% of $50,000, pacemaker implant, it pays 30% of $50,000, pacemaker implant double chambered, it pays 40% of $50,000, end-stage renal failure, it pays 100% of $50,000, major organ transplant kidney, it pays $50,000, and major organ transplant heart, liver, lung, pancreas, it pays $100,000. One other thing I forgot to mention, you did say you wanted dental on this, so let me make sure I've got dental checked. Okay, now I'm going to click in here 2 units for the accident benefit, which we talked about earlier. So you're in for 2 units. The total cost of that is going to be $94.88 for your family. And then we're going to go over here to the dental, and we've added dental in, and let's see what the additional cost would that be. The additional cost for dental is $57.10 for your entire family. Keep in mind that for diagnostic and preventative care, there is no wait. The plan will pay 100% for the first 3 years. For basics such as fillings and simple extractions, there's a 6-month wait. The plan in the first year pays 50%, in the second year 65%, and in the third year it pays 80%. Endodontic, periodontics, oral surgery, restorations, orthodontics, and prosthodontics. There is no wait, but the first year it pays nothing. The second year pays 25%, and the third year pays 50%. So in the third year, it actually comes up to what an actual group policy, $180.50 is what most group policies pay. Also, you have a discount program down here for eye, LASIK surgery, and hearing. All right. So this is our total. This is the total cost of what it is that you're getting. And there's an additional $55 application fee. There's a $30 application fee for the HSP and a $25 application fee for the dental, giving you a total application fee of $55. Now, I think you said you want to proceed to the application. We're going to click here to proceed to the application. It takes a second to come up. Give it a minute. Okay, here we have the application. Let me take the Doe off of here, and I'm going to put the last name, Doe, in here. I'm going to put the Social Security number, 222-222-2222. Sometimes this application can be tricky. It's my understanding, Maria, that you weren't born in the States, so I'm going to click FC for foreign country. Your occupation, you're not none of these occupations, so I'm going to put other. Your employer's name, you told me you were self-employed, and I think you said you were an insurance agent. Okay, and then I'm going to put, now you said you wanted your husband to be the primary, so I guess I'm going to put you, Maria Doe, over here, and I'll put your Social Security number in. Okay, and you as your husband both were born out of the States, so I'm going to put foreign country. I'm going to put in here other, because you're none of these. I think you too, as your husband, is self-employed, and I think he's an insurance agent too. So we're going to go to the next page. Your daughter, I'll put Sally Doe, and we'll put in the social. Gender, female. Date of birth will be 10/27/2000. 2000, and she is 5 feet 3 inches, 123, and she was born in the States. I think you told me she was born in Texas. So I'm going to come down here and I'm going to put Texas in. I'm going to go next. And your address is 602 Prairiedale Street. And you told me that was in Louisville, and I'm going to put your phone number in here. Okay, and your mailing address you told me is the same. I'm going to put your email address in here. Okay, and I need to know the best time for you to call, for them to call you in case they have to do a phone interview. So I'm going to put it in as a time format. So the best time to call will be 10 o'clock a.m. And the phone number, we'll put the same phone number in. Okay, and your primary, now I think your husband was the primary on here, so I'm going to put Maria in relationship, she is spouse. Maria Doe. Since your husband is the primary, and then I'll put Sally Doe, and she's your daughter, in case something happens to you and your husband. Now, I'm going to go through these questions pretty quickly, but I want you to read them on the other side of the screen and make sure you qualify. So I think you're straight here. I think you're straight here, 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 here. Okay, so no one in the house has smoked, so I'm going to put no here. Now, I want you to read these carefully, and I'm going to scroll down and let you go through each one of these. Keep in mind, we're talking about the last 12 months. That's important. So outside of 12 months, this does not apply. So let's go down and look to see on here if anything of these apply for the last 12 months. Oh, wait a minute. You did say one of these does apply. Carpal tunnel. We talked about that earlier. We'll just say carpal tunnel. Okay, so I think that was for Maria. So if that's the case, so let me put in the date. The date it started was 10 of 14, and it ended last 12 months. It ended. We're going to say 10 of 16. So it isn't within the last 12 months. You did not have surgery. The nature of the illness, we're going to put carpal tunnel. Oops. We're going to put carpal tunnel. Physician's name is Jane Doe. Okay, and we can put a little bit more information in here, but we won't go through that right now. If notice that I think we have a rate increase as a result of this. So we have a rate up now because we have that pre-existing condition. Okay, so this is no right here. I'm going to go down. I'm going to go down here slowly. I want you to read each one of these. Okay, so here it's none. I'm going to keep going. Okay, I think this answer is no. I believe this one is no, 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 no. Okay, this insurance is not replacing any other insurance. No, I didn't think so. Okay. Question here says, are there any health benefits, accident or disability insurance enforced now? The answer to that is no. Oh, we can skip this part because it's not in yellow. And let's go to the next page. Okay, I need I need you to sign here, Maria. So I'm just going to sign for you. This is your husband. He's the primary. I'm going to put you in. You're the secondary on here. And it's time for me to answer these questions. Will the coverage apply for, replace, or affect change? The answer is no. Did you personally meet with the applicant? No, I didn't. I used a webinar to do this presentation. I have truly and accurately recorded the information herein. Yes. I have left and made available outline of coverage. Yeah, I've sent you that in the email. A mail certificate to the insured, and now I'm going to sign my name down here, Maria. Okay, I'm going to go next. I agree. I agree. Again, Maria, you need to sign here, so I'm going to sign your husband's name here, and I'm going to sign your name here. Okay, and now I'm going to go to the next page. Now, again, I want to go over this policy with you quickly once again. As you notice, you wanted dental, so there's a $55 non-refundable application fee. Your first payment will be $986.80, and each payment thereafter will be $931.80. Okay, and so this is what it looks like. And now I'm going to go to the last page here, and I'm going to put this information in. Now, by clicking primary, it automatically fills in your husband's information, which is what you gave me. I'm going to put the name of the bank. It's Chase Bank. No, it's Bank of America. Okay, and the routing number is, okay, and the bank, okay, and then I just need you to sign right here, Maria. Actually, your husband is supposed to sign this, so. Okay, and then I'm going to submit the application. I'm not going to submit this application, however, because it's a dummy app. All right, so there you have it. That's a good example of how you go through in detail, do a presentation, and complete an application.